Well, hi, everybody. Welcome into this edition of the 19th Hole Podcast for golfers. I'm your host, Dennis Silvers. We've got a really interesting show today that is really going to hit home with a lot of you viewers. So you've got to pay close attention. We've got a guy on that is just phenomenal, just an expert in his area of expertise, and you're gonna learn a lot. Let me tell you a little bit about our special guest, Dr. Joe Williams. Dr. Williams received his medical doctorate in 1976 from East Carolina University in medical school. He is a fellow of the American Academy of Surgeons and American Academy of Cosmetic Surgery, a member of the International Surgery of the European Society, how do you like that, and hair restoration. In other words, extensive experience in all aspects of hair restoration. So you know what we're talking about. We're talking about guys that are thin hair, that are losing their hair, that are going crazy. Why is this happening to me? There is hope. There is a solution. He practices both surgical and non-surgical management of hair loss for both men and women, and we're going to get into that, talk about the difference. He is the proprietor of the Advanced Medical Hair Institute right here in Las Vegas. Welcome to the show.
Thank you, Dennis. Pleasure
Glad to have you on.
Visit with you.
You are a medical doctor. You could have gone down so many roads in medicine. Why hair?
Well, actually, I didn't start in hair until about 20 years ago, and it was because I had a need myself. But I'm board certified in adult and pediatric urology. Practiced that. Taught other surgeons how to do that for also about 20 years, and then decided to retire from that. Wanted something to do. Had a need myself, and so I got interested in hair restoration, and I've been doing it ever since.
Yeah.
Yeah.
So obviously there's enough to it, and it holds enough interest where you're into it 100%.
Oh, I do nothing but
Yeah.
hair restoration, but we've tried to move from the surgical side, which is expensive. It's typically the last thing people end up asking for. And slowly we've had the ability to bring non-surgical, proven scientifically, to help restore the hair and to maintain the hair.
And to maintain it. We're going to get into that because you're going to find this fascinating with what this gentleman has to offer over and above the surgery or non-surgical. There are a number of theories why people start to lose their hair or their hair starts thinning. But doctor, what is the real reason, and do more men or women lose their hair in general?
Okay. There's about 80 million Americans who need hair restoration. It's been said, basically proven, that about 50% of men at 50 need hair. Women lose their hair in a different pattern, and unfortunately, it's a diffuse loss with them. We men have a male pattern loss, which we all first start seeing the temporal recessions here, and then it
Why
goes
are you
back.
looking at me when you say that? It's true, but go
There's
ahead.
help for you, Dennis, believe me. So what causes it is a breakdown of testosterone. Testosterone is not the culprit. We men need testosterone. But interestingly, women also make a little bit of testosterone in their adrenal glands. We obviously make it in our male parts, in our testicles. But they lose their hair basically the same reason we lose our hair. And testosterone breaks down into another hormone. Most of the audience have heard of DHT. It stands for dihydrotestosterone. And that's the breakdown product. But unfortunately, for those of us who have genetic propensity to lose our hair, that presents itself as like a toxin. And it actually will cause those genetically sensitive follicles to start deteriorating. Same thing with women. Women, though, have a little better opportunity to use hair systems, hair pieces, weaves, curl, color.
Yeah.
They have a way to help mask it a little better. And they actually keep their forelock. That's the front part, typically. So when you look at them on face, which is the most important shot,
Right.
they look like their hair looks pretty good because they
Right.
don't lose that.
Right.
We men lose this first.
Yes.
And one reason we lose them is there's about 40,000 follicles on a full head of hair. But on average, they grow 2.5 hairs on average, but not in the hairline. The hairline, all are single hairs. So you don't have a 2 and you lose 1, you still got hair. Like women, you end up losing, you've got baldness.
Yeah.
So that's where these recessions come from. And so we can move those, and that's basically all that's been available. There's a lot of lotions and potions you hear about, but they aren't, most of them are not scientifically studied, and they're not scientifically proven to actually work.
Right.
And so what we need is non-surgical for these younger people, and that's basically what I've developed and devised in my practice. I think I mentioned that only about 3.5 to 4% of people want surgery. They want
Yeah.
something else.
Right.
It's expensive to have surgery. Some places will shave your head. It's a real commitment, and it's expensive. And because hair loss is a progressive problem, you might look good for 4 or 5 years, but if you can't stop that continual
Right.
balding, then you're going to say, "Well, I spent all that money. Now look,
Yeah.
I look like I did 10 years ago." Or
So
something.
you got to know that you got some follow up with this to keep it the way you want, to keep it looking good. Is there a certain type of hair, doctor, that is more prone to fall out or thin? In other words, does it make a difference if you have curly hair or really straight hair?
Yeah, there's 2 factors that that I speak to my patients about. One is contrast. We'll start with that. Contrast means, I'll give you some examples. If you look at an Asian man, particularly Chinese, they have this coarse jet black straight hair, and then they have this rice white skin. You can see the scalp through that. That makes them look bald quicker. The absolute opposite would be a black gentleman who has curly hair, he has
Right.
black skin, and he has typically black hair. Well, then you can thin quite a bit, but you don't see a white scalp through it.
Right.
And so they
Right.
look, and that's, so curl is our friend, but the lack of contrast is really what drives people to come in. They just
Yeah.
see too much scalp.
Yeah, well, that makes sense.
Yeah.
Dr. Joe Williams is our special guest here on the 19th Hole Podcast for Golfers, coming to you live from the beautiful Rigel Studios in the heart of Las Vegas. Are there different kinds of hair transplant methods?
Yes, there are. The 2 are abbreviated. One is called FUE, and it's often misstated that it's follicular unit extraction, like you're just plucking it out. It's not. FUE stands for follicular unit excision. And like any dermatologist, they have a circular punch, and it's a surgical punch. And so you push into the scalp over shaved hair, and you cut the dermis, and then you pull it out. But it is surgery. The other is a strip technique, we call it, and this is the one that's been around the most. But it's difficult in most hands because it's actually surgery, and you take a piece of skin off the back, and then you close it. But I'm actually
Is that the FUT?
that's called FUT.
Okay, I didn't mean to interrupt you. but
No.
I just wanted to show my
Sure.
expertise.
That's fine. But that's what's been around for. Well, Orrin Trike in New York was a dermatologist that was actually doing that back decades and decades ago, and it wasn't even for hair loss; it was for psoriasis. And he learned that he
interesting.
could punch them out here and put them in an area where you lost your hair from psoriasis, and it would grow.
Wow.
And that was the beginning of what we call plugs. You remember
Yeah,
those?
yeah.
And it was basically not for hair loss, but he was in Manhattan. a lot of rich people up there, and they came to him and wanted to say, we'd like to get some hair in these places, and so he started that. We do follicular units now, where we take the follicle, which will grow about 15 to 18% will grow one hair, and then most of them will grow 2 hairs, but sometimes you'll have those that'll grow 3 and even 4 hairs. The problem with FUE, in my opinion, is they don't. If you have a 4-hair graft, they don't line up like soldiers. They're like this, and some of them are more shallow, and it upsets me because I'm not able to get all 4 of the hairs because they're too far apart for this small punch.
Right.
So what I prefer as a surgeon is just take a little piece of skin. I don't have to shave the head, and I do beautiful work. This is my work, and I think we've already talked about that.
Yeah.
But there is a lot of people trying to do surgeries, and I think you have to be very careful to make sure that you have a doctor that's involved and that has been trained to do this.
Yeah, absolutely. Yeah, you gotta go to somebody that knows what they're doing, like our guest here. How do you choose, doctor, the donor area? Because I know that's very important.
Well, it's in us men. We even the baldest guy has this collar of hair back here, and that's pretty much permanent hair. Now, unfortunately, with women, they have a diffuse pattern, so they don't have as good a donor hair. But with some of these non-surgical methodologies that I'm going to share with you and your audience in a few minutes, we can convert that poor quality hair into better hair, and then they can be could be a reasonable candidate.
Yeah.
But
Yeah.
it's the donor typically is back here, and we move those. But the problem with that is that hair loss, as I said, is a progressive problem. You have to have, and we haven't had until recently, a good way to maintain that, eliminate that toxic effect for those of us who have genetic hair loss. We call that male pattern hair loss, where you lose this first and you start thinning here, and then eventually you can lose it all. But you'll always keep a good quality of hair here,
Yeah.
and that's typically where we get the donor. The secret to what I'm trying to do is let's not let you get to the point where you even need the transplant. And particularly young men, I mean, we talked about that before the show. It's heartbreaking, these young men who are 18, 20 years old, they're going off to college, they've lost all this hair, they're depressed about it,
Yeah.
They're anxious about it, it's really, it's hard on young men. And I didn't encourage young men to get hair transplants because we didn't have anything to guarantee that we could stop the protect, and they want the hairline down low.
Right.
And you think, I can't give that to them because if they lose this back here, that won't look natural.
No.
So you'd have to argue with them and say, no, we got to give you a little bit of recession here so that, no, that's not what I want, doc. So I actually think I told you that. I would not see a young man under 35 for a long time because I didn't have anything to keep him in good shape.
Yeah.
You've heard of the drug finasteride, which is Propecia. That's all we've really had, and until what I've come out with that I'll talk to you about in a moment. But now we can be not more aggressive with those. But I have patients come in and they're barely 30 and they're completely bald. I mean, the whole top's gone.
Wow.
And so we with these non-surgical with the surgical, or maybe just the non-surgical, if I can get to them early enough, I can regrow their hair, keep it strong, and with some very acceptable minimal side effects.
Yeah.
Then they can actually now be able to start where the 95% of them want to start, and that's with something non-surgical.
Right. Yeah. That's interesting. What makes a person, doctor, not a good candidate for a transplant?
Well, the first one I think is age. I think with all the advent of regenerative medicine and things that I'm actually going to speak to, which is really what I want your audience to hear. They've heard about transplants,
Yeah.
but they haven't heard about how do I not need a transplant.
Right.
And so
Right.
what I would say is anybody young, and by young I mean I really think you ought to try these non-surgical because I'm getting great results with them. And that's what I've opened up. Now my patients can be teenagers, they can be young boys, they can be early young adult men. But now I've got something I can encourage them, because before you'd say, well, you may lose it all, and if I put your hairline where you want it, it was not satisfactory because we didn't have a good way to block future loss.
Yeah.
So the young man, all of us are wanting to look young and strong. A lot of men are on TRT, or testosterone replacement therapy. That's giving you more testosterone than a lot of men need. What happens? That breaks down into DHT, and actually it makes their hair loss more rapid.
Wow.
So you'll see a lot of men.
Interesting.
Even on my website, I've got a guy that's all muscled up and he's lost his hair, and that's the point I make. If you're on TRT, those men really need to be blocking that DHT so they don't look great physically, but then look older because they've lost their hair.
Because of that. It's very, very interesting. What is the follow-up procedure, if any, after a transplant?
Well, the transplant is done in one day. I try to move as much hair as I can at once. That's one reason I don't shave the head, and I can take. I can get my average patient gets about 4,200 grafts, and we do that in one day. I do one patient a day because I move so much hair, and it takes us all day long. And then they go home. They can drive themselves to the office and drive home. The follow-up is very simple. I make my own blades, very, very tiny. They look like needles, so you don't really even get scabs. And I have patients. I just saw a man yesterday. He says, "Can I have a phone call the next day and wear a cap?" I said, "Sure you can." But the follow-up is 1 week after I do the transplant. You come into the office, or if you come from out of town, you can do this on your own. I put a little bandana over it, but if I did you this morning, a week from today as well.
Okay.
And you can come in and you can scrub. Matter of fact, we scrub it, clean it up. It may look a little pink, but you get a little epithelial debris because we do all this under microscopes, and we trim all the dermis away without damaging the follicles. That allows me to get them very, very tight, usually 3 times thicker in the hairline than my competitors, because they leave too much dermis and they'll have scabs for weeks. And with the FUE, by the way, this is shaved, and you have scar. You don't have a linear scar, but a guy like me that's got some plastic training, I know how to give you a very acceptable lack of scar.
That's good.
And so I think the real benefit to doing it that way is you have, and those studies been shown that with FUE, you have 400 to 1,200% more scar than with this strip.
Really?
Yeah, but they scare you to death thinking, oh God, look at these terrible scars. But I just remind the patients, you want to get back to your activity as soon as possible.
Absolutely.
I'll have you back in front of high-def cameras in a week. And, and I'll show you how to wear your hair and stuff. You can put, if you were using Topic and other concealers, you can use those at a week. I just say when you get home, just like you're in front of cameras. You don't want to.
That's great.
Yeah, but you can clean that off.
That's
I have
great.
lots of people on TV that I know, they've been in my office and they've been using a little concealer, and they're fine with it, and they can make it look better under bright lights and stuff.
Yeah, no, that's excellent.
But then the last comment. Then I follow my patients at usually 4 to 6 month intervals. It's all included in the fee, because I want to make sure that we're getting what they need.
The results.
Yeah. And so, and then I follow at no charge for the first year and a half. Usually the grafts are in by then. But then what I'm doing now is I'm offering and encouraging most of the patients, especially the young guys, let's do the non-surgical. And I want to talk there's about 5 things I do that I think your audience would like to hear about.
Yeah, for the
Yeah,
non-surgical.
for the non-surgical.
All right, I'll tell you, before we get into that, let's step away 1 minute. I want to show our viewers something that you did recently, and pay attention to this because the doc did it very, very recently, and it's going to give you some good information. So let's roll that.
At Advanced Medical Hair Institute, we offer scientifically proven advanced non-surgical technologies. Patients can improve hair health, density, and growth without surgery. Many see excellent results within 6 months using customized combinations of therapies designed for personalized hair restoration. These cutting-edge treatments are all performed in one visit and make hair restoration affordable without compromising quality. The first product is Hair MD RX. This is our customized prescription, scientifically proven to support hair regrowth and follicle health. It contains the only 2 prescription medications proven to promote better hair quality and convert surviving hair follicles into thriving hair follicles. The key benefits of this prescription are as follows. Our medication provides 97% blockage of dihydrotestosterone, or DHT, in the blood, which is the toxin causing genetic hair loss. It thickens hair shafts, comes in a convenient once-daily capsule that is delivered directly to your home. Our second product is low-level light therapy, also known as LLLT. This treatment uses scientifically established wavelengths of red light to increase blood flow around hair follicles and improve cellular energy production, which is known as adenosine triphosphate, or ATP. The benefits include increased blood circulation to the hair follicles, improved protein synthesis, which is what hair is comprised of, stronger and healthier appearing hair while promoting faster hair growth. The third treatment is regenerative hair follicle support therapy. This product is cosmetically approved by the FDA and is an in-office injectable treatment that contains naturally occurring proteins and growth factors to support hair follicle health. Benefits include promoting hair follicle vitality, improving scalp environment for healthier hair follicles, and is shown to result in stronger hair growth while increasing thickness of the hair. Our fourth treatment is advanced topical hair follicle support. This professionally formulated topical solution contains concentrated growth supporting proteins designed to enhance hair strength and extend the natural growth cycle. The benefits are improvement in hair shaft thickness, extends growth phase of the hair, enhances hair quality, and increases hair growth. For a limited time, we are offering all scientifically proven non-surgical treatments at a significantly discounted package price. All of these treatments work in different ways and are synergistic in benefit. They can all be performed in one office visit. Thank you for your interest, and we look forward to hearing from you soon.
All right, we are back live with Dr. Joe Williams. That was very well done.
Oh, thank you.
That was a lot of good information. We talked about it earlier. I'm a golfer. Your son's a golfer. We're outdoors a lot. I don't like wearing a hat. I like the sun beating down on me. Does that accelerate hair loss or damage my hair?
Well, actually, Dennis, it improves your hair. But it's very much the same light therapy. That red light therapy
Yes.
is actually the wavelength of red and natural light. And we've known for decades. I was an intern in surgery in the 70s, and we knew that the Hungarians came out with a paper that bilateral inguinal hernias were done, and one was covered, the other was exposed to a little bit of sunlight, and lo and behold, the one in the sunlight healed faster. And so that's
Really?
that's what got us
Oh, my
started on the
goodness.
belief that there was healing properties in natural light, and it is the red light spectrum, and it absolutely works.
Very interesting. And keep that in mind if you're looking for something like that. Let's get into a little bit about the non-surgical stuff. You have some options. surgery or non-surgical. If you're a wimp like I am, you hear surgery, you go, So let's talk about the
Okay.
non-surgical.
Now, I've only been able to bring all these products forward within about the last 6 months.
Okay.
The FDA doesn't really monitor cosmetic stuff. And this regenerative program I'm talking about, most people have heard about exosomes and stem cells and
Yeah.
a PRP and
Yeah.
things like that. Those basically do help. And the sooner I can get to a patient before they've lost so much hair, the better result. And quite frankly, the easier it is for them to conceal it. They'll notice it's getting better, but a lot of people won't.
Yeah.
And
Yeah.
so we started before recently with, we mentioned it before, we had finasteride. The problem with finasteride was that you have two receptors. When you break down testosterone into DHT, there are two receptors that we need to block. Finasteride partially blocked one. We had the need to block both. My product actually blocks the receptor that finasteride would block 3 times better than finasteride for that receptor, and 100 times better than finasteride for the other receptor. So we, in essence, can block all the DHT. DHT is not an enemy to us. Testosterone is a great friend to us. So this is the first time I've had, and it's scientifically proven. The study came out of Duke University many years ago, but it was never produced in pharmaceutical companies
Right.
because it's so expensive to do the studies to satisfy the FDA, and the Institute of Health, that the market just wasn't big enough, and it was cosmetic anyway. So the product that I'm making and compounding here locally was never brought to market. It's in the market now, but not at the strength that it needs to be to get the maximum benefit for hair. So I did that about December the 15th, year before last. I had it manufactured here by a compounding pharmacy, and the first patient to go on it was me. And so I took it, had no side effects from it at all, and then have now got hundreds and several hundred patients on it, and they continue to renew. We one capsule, but it also has in that capsule minoxidil, which is Rogaine, and Rogaine has been used topically over the counter. Most
Yeah.
people have tried it. It does work. The problem is it's not enough absorption, and you have to put it on twice a day. It makes your hair oily. It's just a difficult product to work with. So the FDA likes to have tablets because it's a consistent absorption.
Yeah.
And
Yeah.
I like
Makes
it
sense.
because it gives you the maximum dose according to the studies.
Yeah.
All this is, everything I'm talking about, I can show you scientifically and good medical studies that they work. And so that's kind of what I would like most patients to realize. They should just come in and let me look at them. I'll explain all this. And the reason I'm trying to make it available at a better price, honestly, is I want more patients to show off. Now, I
Right.
won't show their
Well,
face,
yeah.
but I want to
Sure.
say, here, look at this book. Every one of these people did this. Some people take it all. I just saw a patient yesterday. I did one thing. I put him on the pharmaceutical drug because he's got great hair, but he's worried he's going to lose it. And he's from up in Reno, and I did a virtual visit with him, and he didn't have any issues with it, and so we put him on that.
I know people are going to call. People are going to email me. I want to get some. How do they get some?
Well, they can go to my website.
Which is?
Well, actually, if they just want the prescription, you can go to hairmdrx.com.
Okay.
It'll take you to my website. I have a more formal consultation on my website.
Okay.
And then you can see that. And as I think I told you, I'm licensed in California, Arizona, Utah,
Yeah.
and Nevada. So
Yeah.
anyone in those states, I can be their doctor of record. They have to fill out an intake form, and I ask them the pertinent questions. They need to review this. The the consultation online is about 5 minutes, 6 minutes. But I explained the data. This paper that came out of Duke University, it was one of 23 major medical schools and institutions that participated in over 400 patients. They were followed for 3 months and then 6 months. And it's a very, very well done study, double-blind, placebo-controlled.
Yeah.
Yeah. The real science.
The
And
real
so,
stuff.
Yeah, and they can go on that with I do reserve the right to call them if I have any concerns, and if they, and most people can tolerate this fine. I have not had any patients in a year and a half that had any significant side effects. But we'll go over all that kind of stuff. But then they can actually, and I don't even charge for the visit right now, because I want people to be able to get to it, particularly
Right,
patients who,
right.
can't really afford a lot of treatment, but they can start there, and then they can learn about the other things if they want to come see me at my office.
Yeah.
Be happy to see them.
Wow, that's great. So that's a winner, folks. Keep that in mind. Why are some people able to grow their hair faster than other people?
Well, a lot of it has to do with your age.
Okay.
I mean, we golf. I'm not a golfer. My son's the golfer. He taught me that I shouldn't try to play golf because he's so good at it. But in any event, younger people. I have a beautiful daughter, and she was 6, 7 years old. She had hair all the way down her back.
Wow.
So you have growth phase of hair growth. It's called anagen. So the anagen phase, hair grows uninterrupted for about 5 to 7 years. Now, the younger you are, the more likely you're going to be growing faster hair.
Mm-hmm.
As you age, we get vascular injury from sun and other things. And so typically you grow hair slower as you age. It's not in the growth phase as long, and it stays in the fallout stage. We call it telogen. It's in telogen about 3 to 5 months, but that elongates as we get older, so it stays. And then once it starts back up, it'll grow for 5 to 7 years.
Right.
But maybe because some of them are affected, you think you're getting thinner and thinner because you are. That
Yeah.
DHT, because you're not blocking it completely, is going to continue to.
Yeah.
It'll allow your grafts to survive, but they don't thrive. And when you come into my office, I can put a 50-power camera and show you that there's hair growing. They just aren't growing strong, and they're not growing. They're just surviving. That's the benefit of trying these non-surgical methods.
Yeah.
I can do it all in 1 hour. I don't have to numb you up. Really, I tell people it's a lunch hour effort, and I can get you in and get you with everything that is scientifically proven, because if it's not scientifically proven, and there's hundreds of products that aren't, then I don't offer
Yeah.
that. I don't offer anything that I can't back up with science.
You hear people on TV, on the radio, whatever, they offer supplements, shampoo to help you grow hair and all that. There's really not good evidence that they do much. Yeah.
And people say, well, I'm taking biotin and I'm taking riboflavin and I'm doing. Look at the foodstuffs in our country. It's all fortified.
Yeah.
If you lived in Kenya, I'd say, yeah, you probably ought to take some of that, but you don't need it because you're already getting plenty of that.
Yeah.
And that's one sad part about anything offered cosmetically. No one really is controlling it.
Yeah.
And there's
That's a good
few of
point.
us that really believe in the science, and if I can't show you scientifically that it works, then I won't even offer it.
Yeah.
And that's what I'm
That's
trying to
great.
do. That, yeah, you can buy 100 different products. They bring them to me and they say, well, I've spent $1,200 on this in the last year. And I said, it didn't do anything, did it? Well, no, I said, because you don't need what they're offering there in nutrients.
Yeah. No, that is great. All right, if people want to get a hold of you, and I certainly hope you do, you want to look up Dr. Joe Williams, because there's a lot of people, and I've got I'm starting myself, a lot of friends that would like more hair, that have thin hair, that are losing their hair. This is the guy you've got to talk to. He's readily available. What's the best way to get a hold of you?
Well, you can go to my website, advancedmedicalhairinstitute.com. That'll take you to my website, and I explain all these things. But what I'm here for is to tell people we've got good medicine, good science now, and I haven't had it more than 6 or 8 months, and I'm trying to make it available. Like I say, it's not about the money. I need patients to come in and let me show them, and let's see if it's as good as the science says it is.
Right.
And then if it is, all these poor young guys that are scared to death are going to look like daddy or grandpa. They're going off to college looking like they're much older than they are. It's a depressing thing for these. It's a cruel.
It is
a cruel thing to do to a young man.
But that's part of life. He wants a before and after picture. Okay, before. Take my stuff, and that's what you're going to do. Anyway, I know you got to go. You're busy.
Yeah.
Thank you so
It's a
much
pleasure,
for coming
Dennis.
on. Great
Enjoyed it.
information.
Great.
And follow up with them if you've got any concerns about your hair. And everybody I know does. And you could do something about it very, very, very readily. So, Dr. Joe Williams, thanks.
Thank you.
So on behalf of the doctor, myself, Dennis Silvers, this is the 19th Hole Podcast for Golfers. We hope you enjoyed it, and we will be back with another show very soon. So until then, so long, everybody. Take care of your hair.